This video is going to be about the first cervical vertebra, or C1, also known as the atlas. It's known as the atlas because it supports the skull like Atlas supported the earth. We're going to go over the bony features first. So this is a superior view, and you can tell it's a superior view because of the large oval superior articular facets. Those articulate with the convex occipital condyles. So they're concave. Notice how they're longer in an anterior-posterior direction than they are in a medial-lateral direction. That means that there's a larger range of motion at the atlanto-occipital joint in the sagittal plane for flexion and extension than there is for lateral flexion or side bending that occurs in the frontal plane. I should have started off by saying this is anterior and this is posterior. Another really important thing that you'll notice about C1, it has no body. And where the body would have been, which is right here, is replaced by the dens. So if we articulate C1 and C2 together, or the atlas and the axis together, we can see that the dens is in the position of where the body of C1 would have been. But C1 has no body. It also has no spinous process. Instead, it has a posterior arch and a posterior tubercle. Posterior tubercle is for muscle attachment, and it's for the rectus capitis posterior minor, one of the muscles of the suboccipital region. Not one of the borders of the suboccipital triangle, but one of the muscles of the suboccipital region, the rectus capitis posterior minor. Another thing you'll notice is on the superior surface of the posterior arch, there's a sulcus or a groove here and here. That groove is for the vertebral artery. So the vertebral artery ascended in the neck through the transverse foramen, starting at C6, or the foramen transversarium, starting at C6, came through the transverse foramen of C1, then it directs itself posteriorly and medially and lies in a horizontal position in this groove or sulcus on the superior surface of the posterior arch of C1. This is the anterior arch, and on the anterior surface of the anterior arch, there's an anterior tubercle, and that's also for muscle attachment. The longus colli, one of our deep neck flexors. On the posterior surface of the anterior arch, there's an oval facet, sometimes called the fovea dentis. That's for the dens. It's usually covered with articular cartilage, and it articulates with the convex facet on the dens or odontoid process. Like so. So we've got the concave facet on the posterior surface of the anterior arch of C1 articulating with the convex facet on the anterior aspect of the dens. That forms the median atlanto-axial joint. The median atlanto-axial joint. That's a pivot or a trochoid joint at which rotation takes place. Another important part of that joint is the transverse ligament of the atlas, which attaches from the lateral mass of C1 on one side to the lateral mass of C1 on the other side. And it restrains or holds the dens against C1. It doesn't attach to the dens, but it goes from the lateral mass on one side of the atlas to the lateral mass on the other side of the atlas. That's like a seatbelt holding the dens to the anterior arch. There is a synovial cavity between the dens and that ligament, the transverse ligament of the atlas, or in Hollinshead's textbook of anatomy, he calls that a bursa. Either way, there's a synovial cavity between the dens and the transverse ligament of the atlas. The transverse ligament of the atlas is part of the cruciform ligament. Also notice the transverse foramen or foramen transversarium for the vertebral artery. Here's a transverse process. Instead of having two distinct tubercles, it's just one large transverse process. And that's for muscle attachment and ligament attachment. And specifically, I can name a few muscles. The levator scapulae attaches to the transverse process of C1. The splenius cervicis attaches to the transverse process of C1. The obliquus capitis inferior and the obliquus capitis superior, both muscles that form borders of the suboccipital triangle, attached to the transverse process of C1. If we turn it over, we see the inferior surface, and we see rounded inferior articular facets for articulation with the superior articular facets of C2 to make the lateral atlantoaxial joints. The two lateral atlantoaxial joints. Those are plain synovial joints. We'll articulate the two together. Look at them from an anterior view. So you can see the two lateral atlantoaxial joints there. Notice the slope. So the inferior articular processes of C1 slope inferiorly and medially, while the superior articular processes of C2 are sloped superiorly and laterally. So that's the lateral atlantoaxial joint. That works with the median atlantoaxial joint, and rotation occurs there. Okay, so just to review to make sure I'm covering all the osteology, we've got a cervical vertebral with no body. The dens of C2 sits where the body would have been. No spinous process. Instead, it's got a posterior arch with posterior tubercle, an anterior arch with an anterior tubercle, and a facet for the dens, a concave facet for the dens. We've got large oval concave superior articular facets to articulate with the occipital condyles, the convex occipital condyles. Large transverse process with the transverse foramen for the vertebral artery. Okay, so let's talk about some of the other ligaments other than the transverse ligament of the atlas. Attaching from the posterior arch of C1 up to the posterior margins of the foramen magnum of the occipital bone is the posterior atlanto-occipital membrane. So we've got this sheet-like membrane going from the posterior margin of the foramen magnum of the occipital bone down to the posterior arch of C1, posterior atlanto-occipital membrane. And then if we turn it around, similarly on the anterior side, going from the anterior margin of the foramen magnum of the occipital bone to the anterior arch of C1 is the anterior atlanto-occipital membrane. Attaching from C1 to C2 is the anterior atlantoaxial membrane. Here, whoopsie, sorry. Here, anterior atlantoaxial membrane. And then posteriorly, from the posterior arch of C1 down to the lamina of C2 is the posterior atlantoaxial membrane. Another thing that I want to talk about with this C1 vertebra is the relationship of the dens and spinal cord. So remember, the dens is anteriorly positioned. It's where the body of C1 would have been if it had a body. And there's something called the Steele's rule of thirds. So the dens takes up about a third of the space. So if you think about this vertebral canal here, formed by C1, a third of that space is taken up by the dens. A third of the space is taken up by the spinal cord. And I have this chapstick I'm going to stick in like the spinal cord. So a third of the space is taken up by the spinal cord. And the final third is space between the spinal cord and the posterior arch, and a space between the spinal cord and the transverse ligament and dens. So that makes up the other third, the final third. So this is called the Steele's rule of thirds. Now, if the transverse ligament of the atlas is ruptured, that means that the C1 can dislocate anteriorly on C2, and that would cause the dens to encroach upon the spinal cord. Another clinical correlation for C1 is the Jefferson fracture. The Jefferson fracture is the mechanism of injury is a blow to the head or the blow to the top of your head, like you're in a diving accident, and the axial load comes down through these condyles from the occipital bone and through to C2, and it's almost as if C1 is being smashed between the occipital bone and C2, and though that axial forces cause the lateral mass to separate or move laterally, and typically you get symmetrical fractures of the posterior arch on both sides and the anterior arch on both sides. And if you're looking at an X-ray, you would see that the lateral masses or the inferior articular facet of C1 would overlap C2, or it would overhang, because the lateral masses were driven outwards, and those four symmetrical fractures allowed the lateral masses to move laterally relative to C2. So you get this overhanging. Now, if the transverse ligament is ruptured at the same time, then the transverse ligament of the atlas, then there's a susceptibility of dislocation of C1 on C2, and because the dens, that osteoligamentous ring has now been disrupted because the ligament's been disrupted, and there's a chance that C1 will dislocate anteriorly, and now the dens will encroach on the spinal cord. Okay, I think I've said everything that I wanted to say about C1, or the atlas. Hope that was helpful.